Hi everyone, welcome to this lecture on feminist therapy. So one of the first aspects of feminist therapy that I want to emphasize as we're looking at different key concepts is that, like existential, a feminist approach to therapy is philosophical in nature, and so it's a mindset and not necessarily an intervention. And so there's lots of different types of feminist approaches have also been integrated with different types of therapy. There is feminist CBT, feminist psychodynamic, and then there are people who would define themselves as feminist therapists within itself. So I just wanted to start off with that because I think that will help you to understand some of these key concepts. So first of all, when a feminist therapist is working with a client, they're looking at the different ways that that client's social, political, and cultural context have helped to shape both who that person is and the struggle that they have come to you to work on. And feminist approaches, social cultural approaches, social justice approaches, all three of these approaches recognize that power, privilege, and oppression play a role and influence our clients' psychological and, just holistically their well-being. And so rather than just saying, this individual here has anxiety, the feminist therapist might look at this individual and say, well, they're struggling with having an oppressed identity. Maybe they come from the LGBT community, and they're suffering in terms of their socioeconomic level, and so their anxiety is really just a normal physiological response to dealing with these injustices. And in that way, you are not saying to an individual that they themselves can fix their depression or anxiety, because it could very well be the toxic system that the individual exists within that's producing their current psychological state. And to look at the ways in which power, privilege, and oppression influence someone's well-being and lived experience, you're going to look at their social identities and how that influences the person's way of being in the world. So first and foremost, through this lens, if you're taking a feminist approach, the client is the expert. They know what's best for their own life. I will often provide several interventions for a client to consider, and I always let the client lead the way in terms of what we choose to do. There is complete transparency in the therapeutic process. And so anything that I am thinking about, any ways in which we're going to work together, there's nothing magic here. Everything's going to be talked to you as part of the process of engaging in this kind of therapy. And we look at traditional assessment approaches, which are typically, we think of assessment approaches as sort of like, a very popular one is the Beck Depression Inventory, which is a quantitative approach to measuring someone's level of depression. And at times, those tools have been normed on groups, have been normed on a European, college student age, traditional college student age group, rather than a diverse group. And so the instrument itself, may not be normed for that person. And for that reason, a feminist therapist is aware that using that type of psychological assessment should not be done, and or if utilized with other methods. And so you will look at gender role expectations, both from their family and societal. And Gilligan was critical in recognizing that women's development was judged by male norms, by the patriarchy. That if traditional human development models uh, seek, the goal is for an individual to seek autonomy. And through a feminist lens, uh, you can develop you develop as a well human being by engaging in relationship across the lifespan. So it's really about having an interconnected way of being rather than seeking autonomy as a way of judging whether someone is developing healthily or not. And I think one aspect of this I just want to point out is that there could be a misperception that one would be thinking about this through a cisgendered female lens, when in fact feminist therapists have also been very critical about stereotypical definitions of gender identity. And so all of that holistically is taken into account when working with any individual client. And your textbook didn't talk about this, but it's an important term, so I want to bring it up here. I'm actually surprised that your textbook didn't include this because it's such a critical approach to working through a feminist lens. So intersectionality is a term that recognizes that we all have multiple social locations. So for example, a white woman who is Christian and 18, well, let's make her, rather than 18, we'll make her 50. So a white woman who's Christian, who's 50, has a greater degree of power and privilege in our society than, let's say, a black gay male. So, and yet, the nice thing about intersectionality is we recognize that social location can have multiple points. So, for example, if we go back to the first example, actually, if we're thinking about the gay male, he has male privilege that may inform some of his beliefs about women, even though his identity as a gay male is marginalized and oppressed. And the reason that we want to think about our different social locations is because we want to think about what is going to be the relational and social expectation of our client when we're engaging with them in a session. And looking at their various cultural identities allows us to develop mutuality, a sense of mutuality within our relationship. So we're not going to ignore the role that culture plays. Culture under a large umbrella here. So culture including gender, class, race, sexual orientation, ability, and nationality is one example. And relational cultural theory, my absolute favorite theory that exists, I, Abby, utilize an RCT approach. So even though I draw from cognitive behavioral theory and mindfulness theory and creativity, all of the ways in which I consider my clients' concerns are first developed through an RCT lens. And what that means is that I am looking at the level of connectedness that my client experiences within multiple systems. And it says here that RCT emphasizes the vital role that relationships and connectedness plays in the lives of women. I'm going to call out the gender bias of these slides here in terms of thinking about feminist even being associated with gender identity of a cisgendered woman here, and that's just not true. There are plenty of men that utilize relational cultural theory because the theory recognizes that without paying attention to the role of culture in the relationship, we could potentially not build rapport with our clients. And that when we do pay attention to the role of culture in building a relationship with someone, we're going to be able to have the level of connectedness that we're going to need so that if a relational disconnection occurs, so let's say we're in session and we provide feedback to our clients that they don't like, that they will let us know that they're upset about that and that we can talk through that rather than completely disconnecting and shutting down, which is within itself a way to survive trauma, really. And so we're looking, an RCT therapist is constantly looking at this idea of relational connectedness and using and cultivating a quality of connectedness that will help you to make it through disconnections with your client and to explore their disconnections. And you're doing all of this so that you can help your client to build relational resilience. And so what does that mean? It means that, by having this open and accepting and I don't want to say loving, but a form of love, a caring relationship with another, and authentically. That's another major point about relational cultural theory, or feminist approaches in general, is that you really bring your authentic self into the therapy session, and you recognize all the different ways in which culture might tell us to be inauthentic. So, for example, if you go to work every day, are you the same person that you are at work, that you are with your family? In what ways do you have to change? Oh shoot, I can't remember what movie it is. I'll have to follow up with everyone, but there was a great movie that came out this last year, and the basic story is that this black man is moving up through a company that he's in because he's developed such a good white, white selling voice. And so his customers buy lots of his goods. And as he moves up the chain within the company, he has to present quote unquote white all the time, and he starts to lose himself, and then he starts to lose his relationships, and he becomes disconnected from his true self and from the people in his life that are important to him. And so a relational cultural theory therapist calls that a relational image. So the sense of self that one develops because of societal norms. And we might look at ways, if I were working with this gentleman, I might look at ways that he can, the ways in which that type of oppression can influence anxiety, depression, other types of, psychological suffering, in addition to what he might be able to do from a social action perspective. And feminist therapists recognize that you can't separate your consciousness from what's going on politically. And the political is personal is sort of the famous saying that comes along with this. And of course, we still see so many examples right now to pull from, as we potentially watch another Supreme Court justice get nominated, who doesn't believe that women should be able to make decisions without their husband giving it an okay. Well, if a court case comes up, I'm very concerned about the what that means for women's freedom in this country, and also what that psychological impact is going to be for my clients. And we look to women and other marginalized groups to understand what's going on, and how white supremacy and has really hurt isn't the right word, traumatized, what it's like to live in that daily space, and what that means, and that space in particular within itself can be traumatizing. And so I often talk a lot about how, the defense mechanisms that might be coming up for them in their lives or in our sessions in the moment are all the ways in which they've had to survive such a toxic system. And again, the counseling relationship is very egalitarian. There's this real sense of mutuality. Um, it's not uncommon for a feminist therapist to, if they've had a similar struggle, to share that with their client as a form of self-disclosure. And it's not self-disclosure because it's my own therapy. It's self-disclosure so that the client uh, can further their healing. So, for example, I've dealt with sexism in the workplace as well. And here are some ways that I've dealt with microaggressions. That would be a way that I might use my own experience with a client to affirm what they have experienced. So we're going to look at socialization, not just gender role, but really cultural socialization. We're going to look at internalized beliefs that may lead to internalized depression, and we're going to understand that sexist and oppressive beliefs systematically harm people in our country. We're going to look at different ways, skills that clients might use. Again, a feminist approach is a theoretical or philosophical in the sense that I can pull from lots of different other interventions from other theories. Often I certainly will teach clients about mindfulness and positive self-coping as just a way to help them ground if they're feeling triggered. And feminist therapists will really understand the impact of policy on their client's life. And so they may be involved with organizations in their communities and at large that seek to develop and adapt policies that will allow for more equity in the workplace. In fact, if we do a little juxtaposition here with our own organization, the American Counseling Association, by supporting them, they hire lobbyists that support us, counselors. And when we lift up counselors, we also lift up our clients. And so there's a direct impact in the way in which we work as counselors. We need to be social justice oriented. We've got to get involved with our associations at a minimum to help to change the ways in which we are able to provide treatment. So lots of discussion about power and the role that it plays in being connected or not connected, and recognizing the value of one's own subjective experience and trusting it. So I think, one of the things that I've noticed about the Quarry text in relation to its critique of, that feminists are critical of the DSM, that is absolutely true. So I don't discount that. And feminist therapists do use the DSM. And so they, I think feminists have led the way in terms of the critiques around the categories within the DSM. I mean, homosexuality was the term, used in the DSM in the 70s as a form of pathology. And we obviously know it's certainly not a form of pathology. And that, let's think of another example. Gender identity is another one. And it's such a catch-22 because if we don't have the DSM in the code to be able to get payment, we're not going to be able to provide service. And yet so many of those classifications are embedded with all kinds of bias. So there's a focus on empowerment, self-disclosure when it's in support of the client. You're going to look at the way in which the client what role gender plays, but again, not just gender. The text is not quite right here. It's culture in the largest sense. So what role, what stereotypes from the culture has the client internalized? So if I see somebody who is very, exhibiting like, a lot of bravado, let's say I have a male client who's very, has a lot of stereotypical ways of being male, I wonder about if they have any sense of self-identity outside of what they've been fed from the larger culture. And then that might be a place for us to look at, what do they value? How does that shape the ways in which they behave in their life? And without a doubt, you're going to look at power dynamics. I always ask my clients about what it's like to be with me, what it's like to be in therapy now or in the past, because while it might not feel like it, we are in a place of power over our client, and so just to be aware of the inherent power differential that's there. And so, just some techniques, I guess they want to give you. I'm not sure that any one of these, to be honest, is, I would say, quote unquote, a feminist approach, but these might be some techniques that you might use within a feminist approach. So you might give your clients some reading material. I absolutely will encourage clients to go on Google and look up different aspects of their experience, or finding support groups, LGBT support groups, female support groups, socioeconomic support groups. There's a lot there. Assertiveness training is important for everyone, but in our country here in America, women are really trained to be quote unquote nice, and they don't know necessarily how to be assertive and use I statements and get what they need. And so they might shut down or you know, experience other difficulties in their life. So you might be coaching somebody to help them get what they need. You are reframing and relabeling experiences. So, you know, right now, if you have a marginalized identity, like, I am just in awe of your ability to be resilient just through an incredible amount of complex trauma. And that might be one way to reframe if someone's experiencing anxiety and depression, and really personalizing it and saying it's their fault, sort of recognizing the larger system at play. Helping the client along with you. Sometimes you do it together. Get engaged in social action. Everybody should be a member of the ACA. And group work. Lots of groups from a feminist perspective. Most community mental health centers will have groups like, women in trauma, moms groups, you know, groups that might be considered gender normative in that way. It's a diverse group, and it decreases the sense of isolation and loneliness. When I am thinking about whether a client has been successful or not, do they have social supports in their life, and social supports of quality where they can be authentic and feel nourished in multiple ways? And if not, what makes that difficult? That's going to be part of our work together. Also, as a feminist therapist, if my client wants to stay with me for years to come, I'm really okay with that. I don't see that as pathological. Therapy doesn't need to be short term. It can. You can come for one session, you can come for 21 sessions, you can come for 210 sessions. I value our connection, and if there are aspects of the work that we're doing that are impeding our connection, that's going to be part of the work that we do together in looking at how that might be a manifestation of other relationships within the client's life, because they're just acting out a pattern of relationship on you. Self-disclosure is encouraged when it is going to help the client further their own self-awareness. And not surprisingly, it can really, meet a needs of a large audience. And feminists have been the first to really critique psychotherapy and recognize the values inherent within our own professional culture. And we advocate where we can to change the social systems that are causing the pain. and we're aware of our own values. We're constantly in some form of self-reflection about the ways in which we have lived our lives and how that influences the quality of relationship that we engage in. And, intersectionality is almost, a common word in our lexicon now, and that came right from feminist approaches. Uh, you know, Feminists and particularly black feminists have really led the charge in addressing issues of power, privilege, and oppression within therapy. And feminists were the first to call attention to domestic violence and child abuse. It's why we have the laws that we do currently that, are really not even close to being enough in many cases, and yet it's better than in many other places. And so, just a little bit of history. Early on, before our ethics were really developed, there were an awful lot of mostly male therapists who were getting into relationships with their female clients. And feminists were the first to say that's not only not okay, it's traumatizing to the client. And feminists recognize there's no such thing as a neutral stance. So it's interesting the text even calls that a limitation. Um, but I'll put it out there because it's in there. And that therapists must be aware of their own cultural values. And even within the idea of being a feminist, that there are different types of feminisms and different levels and experiences of power, privilege, and oppression within different types of feminist approaches. I think really out of all three of these limitations, the largest one, and really this has actually started to change very recently, there is a much larger empirical support than there once was. And, of course you could say the training for feminist therapists, if it's sporadic and not systematic, you'll lack quality. But that's really true of any therapy. I mean, if you're just hodgepodging and not real clear about where you're headed, that's going to happen anyway. So this is a really brief, believe it or not, overview of feminist therapy. There's lots of different approaches to feminist therapy, and I encourage everyone to take a moment and look up the different approaches and seek further learning. Thanks for listening.